Hi, everybody. I am Paige Elizabeth, and I'm back with Katie Warpinsky, and we're talking again about more issues that are common to people in general, but specifically women. And, trying to make a habit out of having these discussions because I think it's important to educate people. I know that some of the stuff I go through is so random, and yet other people are like, oh, I am too. And they just didn't have the courage to talk about it. So we're going to talk about it.
Let's talk about it.
How are you doing today, Katie? I know we had kind of an interesting day getting started.
It only took us like 5 hours to get going. But here we are. I mean, yep, we're all kind of going through it right now. So I know Paige and I are going through it. So maybe some of you are going through it too. And
Well, yeah. Katie just moved cross country. I put Charlie down on Sunday. That was just so heart-wrenching for me. And like the bags under my eyes. Like I never really understood bags under the eyes. And I'm like, well, I guess now that I'm 42, I understand bags under my eyes. If I cry too much, like I just look at myself and I'm like, okay, girl. So much crying, And but anyway, got to keep things moving. And so here we are. We didn't do yesterday because of that, but today here we are. And we wanted to continue our discussion about the microbiome, because Katie is an MD and that's kind of her specialty is the gut. And so we wanted to talk a little bit more about that, especially because first of all, there's a random E. coli outbreak. I don't know if that has anything to do with the E. coli I had recently, but I had E. coli recently. And it was really weird because I didn't have your typical acute symptoms. Like I had a little bit of indigestion when I ate at night. And that was the most I experienced in my GI, right? That was like the worst I got. The thing that was chronic for about 6 weeks, 2 months was just dehydration. And I'm like, how am I so dehydrated? Like I would drink water all day. I drink like 7 of these things and like within minutes just pee. And I'm like, why am I not hydrating? And I'd cotton mouth and it was just, we couldn't figure it out. I'm like seeing my natural specialist and then I end up with a UTI.
the dreaded UTI.
And I don't get UTIs. Like literally the last time I recall having a UTI, I was in San Diego. I was 7 years old and I refused to take off my swimsuit. Like that was the last time I dealt with this. This is not something that like I'm used to. I know a lot of women are, but this is like not my wheelhouse, right? And so, and even the UTI symptoms, because I'm not used to UTIs, I was like, what is this cramping I'm having? Just
Oh,
for 10 days. And then I'm like talking to a friend of mine and she goes, that's a type of UTI. Because I wasn't having urgency. I wasn't having burning. I wasn't having your typical symptoms. There was just some weird cramping that would come and go in my pelvic floor. And I was like, am I getting that old? What is this? And she's like, no, that's like a deeper form of like a UTI. Like it's not a superficial, but yeah, that's a UTI. And I was like, oh, great. And ironically, it kind of crossed over. My natural doctor and I were like, okay, yeah, something's off in your microbiome. She wasn't quite putting her finger on it, but like we put me on a high dosage of probiotics, which gave me diarrhea and nausea. And so she's like, okay, back off. And then as soon as I backed off, the UTI went from like some weird cramping to like full blown pain, like horrific back pain. Like it just took over. And yeah, so I had to get on antibiotics but it was systemic. It wasn't like, you know, just the craziest thing. And we were talking last time about the brain gut connection. And I had been so stressed and having anxiety, which isn't normal for me, over business stuff. And then I'm like day 5 of the antibiotics, and all of a sudden I'm not feeling stressed over my business. And I'm like, maybe it was the E. coli that was feeding into my anxieties. And then, of course, it all came back when Charlie died. But you know, the stress, the emotional stress, but it was just so random, this experience, and the dehydration part. And you were telling me, Katie, like before I even tested to find out it was E. coli, you're like, oh, E. coli is really known for causing dehydration. It's like, really?
E. coli is like the number one cause of bacterial cause of UTIs. But people hear E. coli and they're like, oh my God. But you don't have to be afraid, because most of us, if not all of us, have E. coli naturally existing in your gut. Like, it's his happy place, he's good there. You want him there because you have two types. You have the pathogenic kind, which is, say, like when you eat something bad and then you're violently ill, you think that's that kind. But then you have the normal kind that, that he just lives there and he actually keeps, I love that it's a he, I don't know why. He's a man. Of course, it's a man. Keeps a lot of things in check. And so you do want to have the natural, like, whoever wants to occupy there, but keeps things in a homeostasis. But then sometimes things just get out of whack, like, especially like when you're taking an antibiotic, then even though for you felt better, some people get, it's a side effect of diarrhea. And why does that happen? Because it's also killing the good stuff and then gives a chance for the bad guys to kind of come in and take over. And that's where that comes from. But anyways, sometimes you could just get an overgrowth, and you have three types. You have the UTIs that affect your bladder, your urethra, or your kidneys. It can be all of them, or it can start somewhere lower, your urethra, but you could just get a little bit of an overgrowth and boom, it takes nothing for that bad boy to explode and those painful symptoms happen.
Yeah, I mean, like I said, I certainly wouldn't have gone 10 days if I had known. You know what I mean? Like I would have done something. Obviously taking BioK, so taking 50 billion of BioK like 3 times a day. And it was doing the job, obviously. But the side effects of combating it with probiotics was diarrhea, nausea. So that was actually, but then like I said, I got off it because I'm like, I'm trying to work here and I'm like nauseated throughout the day. So I need something a little more gentle. And then the symptoms got just blew up on me. And that was scary because I've never had, obviously, like a UTI is not my thing, but then to have it end up where I had spasming, like it was from like my bladder all through my right side into my low back. And I'm thinking, do I have a kidney infection? And it did not get to my kidney, thankfully. But it, because my first thought was like kidney infection, and then I thought, what's a fucking kidney stone? Like, what is a kidney stone? Like that's really bad. And I gotta be honest, like I've never given birth, but the contraction, like penetration of that pain that made me so nauseated that like there was no position I could sit in, lay in, stand in without wanting to just die. And like it would show up in the morning. It happens 2 different times. And it was between 9 and 11 a.m. And in Chinese medicine, that's the spleen hour. And I was like, okay, obviously like my blood cells, my T cell count has jumped to deal with this issue or something. It's activated. And like, I'm like, yeah, I'm glad I haven't given birth. Like, this is awful. Like, because I imagine when you give birth, your entire lower region just
Explodes.
I was like, oh my God, I'm just experiencing it on my right side, but like I can only imagine. And it was just horrific. And the nausea, and I couldn't throw up because it was the morning. I hadn't eaten, there was nothing to come out. It was just that dry heaving. It was pretty bad. And it just blew my mind. I'm like, here I am. I'm healthy, I take care of myself. Like, and I think that's also the other thing. Like, you just never know when you're gonna just randomly catch something,
Yeah.
or again, was this a mindset thing? Did my stress feed into the bacteria and then like, or did the bacteria feed into the stress? Like I wonder that part.
I think it's a culmination of multiple things. I think because we had talked about in a previous video how stress, cortisol, all of that affects your gut biome. You know, it throws off other hormones that then throw off what's happening in your gut. And we talked about how important, you know, your gut is, those feeding those microbes that are good for you, that you want and you need to nurture. I mean, it is a fine line every day of making sure that everything is balanced. And once one thing gets out of whack, it's a chain event, and it goes right back up to the brain. And I mean, you experienced it, right? When you said you took your antibiotics, it's like, oh, once things started feeling like you're killing the bad guys, you started to mentally just feel better because you're getting rid of them.
Mm-hmm. Yeah, no, definitely. It was a pretty bizarre experience. And we were talking about getting on this call today, and you texted me and you're like, why is everything going wrong? And I said, welcome to my world. It was like that as I've been relaunching this business, it just seems like obstacle after obstacle. And it's like, it's so hard to practice being present and not identifying with the shitstorm that arises in the interim of creating that change. And when your body is working against you, that's one of the worst things to have because you can't distract from it, like you're in it. I
And you have no
mean,
control over it. I mean, to a certain extent, you have control, but like at the same time, if you already have that imbalance and nature is taking its course and it's wreaking havoc on your system, it's like you can only do so much, and you have to like give it time, antibiotics. But like it's hard when you feel like you're not in control of your own body.
well, and there's a lot of, for example, it has been a very stressful time for me, and I had a lot of trauma released on the vagus nerve level. I had literally had a release done. And a lot of things, a lot of cycles closed out at that time for me. And so it was almost like because I had been in hyperdrive for so long and then to just shut that off, I don't know if my immune system just didn't know how to regulate after that, because then I got sick from the fires in California, and then as I'm getting better, I get a cold, and then as I'm getting better, I get the flu, and as I'm getting better, I get the UTI. And so it was like one thing after the other in terms of my body trying to regulate this new homeostasis, and I just became a victim to whatever was out there. I mean, literally. And I'm like, oh my God. At one point, I was like, am I just trying to sabotage myself? Like, what is going on? Like, am I some part of me just like, nope, we're not moving forward. We're just not doing it. And we're going to make you sick over and over again until you just submit and give up on these goals.
And
But
it's hard because once your immune system, it takes a lot for you to be fighting one thing. And then you realize how susceptible you are once your immune system is like really, it's like having a car full of gas, you know, and that you're using up that gas to get somewhere, and like that's your immune system. It's using up everything you already have to fight something. And so when you got nothing in the tank, how are you going to fight something else that you were just exposed to? And
mhm.
so that's why it's important to just keep filling up the tank, keep, you know, the day, because people are like, why do I need to do a daily vitamin, a daily this, a daily that? And it's like, because you just don't know when your system's going to get hit, and you need to have reserves. That's how I see it.
No, absolutely. I mean, it's definitely like vitamin D is that for me, I love my vitamin D. I used to get bronchitis all the time when I worked in nightclubs, and then I started taking vitamin D, and I haven't gotten bronchitis since.
Oh, that's amazing.
Yeah. So, because it's so smoky. So you catch a cold and then it turns into bronchitis just because you're trying to heal while being in these ridiculously smoky environments. Yeah. So I think I caught bronchitis maybe 4 times over the course of, like, I don't know, 6 years. But then I started vitamin D and I haven't never got it since.
There's something to be said for that. That and magnesium. Magnesium is so important too.
Oh, totally. I mean, that's a daily thing for me, but I feel like yeah, the other thing people don't realize is, this is what I was thinking. I was like, I don't want scar tissue in my UTI or my urinary tract. Like, what is going on? Like, if I don't treat this could, Because like bronchitis, that'll create scar tissue. Every time you cough, you end up creating more
Mhm.
scar tissue. And it's just like, I don't want that in my body, you know? Even if I catch a cough, I will actually take ibuprofen because it tends to numb out that need to cough and soften it. So that way you're not like so hoarse.
Absolutely, because ibuprofen, which is also like Motrin, it's an anti-inflammatory. And
Mhm.
so if you're inhibiting that inflammatory process, which is what's causing you to cough, because everything's irritated, I mean, I'm all for anti-inflammatories.
Oh yeah. Well, on an acute level, I mean, not chronically, I wouldn't say live on them, but like if you have an issue where you just can't function, yeah.
And like when you start to feel it coming, it's like, don't be afraid to, get ahead of the ball and know, okay, this is where this is going. Like, let's preventative treatment in that sense.
Hmm. No, absolutely. So I was just blown away. Like as I get into more and more of this work, I'm like getting a firsthand lesson in the gut and just like how sensitive it is. And yeah, I'm not prone to yeast infections as a result of UTIs. So or as a result of excuse me, antibiotics, thankfully. But so I did take BioK every day that I was on the antibiotics. I also opted to supplement twice a day with oregano oil because I was looking up, like, I don't have a regular doctor to go to. And so I went online initially and got a script because you can order one. And I just chose amoxicillin because I know that works with my body. But then when my symptoms weren't going away fast enough, I was a little concerned. I know we had talked about that. And so I ended up calling my plastic surgeon, who's my buddy, and he was like, "What do you need? I got you." And he called an augmentin, which is like a stronger form, I guess, right? Like you know more about that than I would.
No, it's like an adjunct, has a usually Calvinic acid, and it just sort of helps work better. It
Mhm.
just like a little oomph to it,
Yeah.
a little
Yeah. And I
scare.
was like, because I was like, why isn't the amoxicillin working? So I was researching it and it said that E. coli is becoming more and more resistant
Then
to antibiotics in general. And I was like, oh my God, like that sucks. So I'm like, well, I just can't ignore this. So in the meantime, I looked up the effects of oregano on E. coli and it said it was even more effective than most antibiotics.
that's so interesting. So I'd never heard that. But it's good to know. How do you apply it? How does the regimen work for it?
Internally, so I have oil of oregano. I was doing 15 drops. I'd put it in a caps, like a capsule.
Oh,
And
got it. Okay.
yeah, morning and night. And oregano is a superfood for me, so I knew my body would do well with it. But I just wanted to have that like backup. So if they were
Absolutely.
getting little guys that were like, "Oh, we know this routine," I was like, "No, no, no, you don't. You don't know."
Working in the shadows.
So I took the oregano with it and with the augmentin, and I was even taking D-mannose. Are you familiar with D-mannose?
I'm actually not.
D-mannose is something that I learned about a while ago. It doesn't work on every bacteria. E. coli, staph is the other one, right? Is the second,
Oh,
is the other one that causes UTIs?
you can get a staph one. And staph is just, I'm actually hearing about a lot, like a huge uptick in like staph infections, like skin infections, which
Mm.
is very random, but like it feels like everything's sort of having a resurgence right now. And
I recommend just getting on oregano like once a day, just as to keep things at bay because it's so powerful. It'll just burn through a yeast infection. Like it'll just burn right through it. It's so powerful.
did you have
Um,
any side effects?
that's probably also why I didn't get a yeast infection because I was on oregano. So, but it's really powerful stuff. But anyway, back to D-mannose. D-mannose is like if you looked up, you'd be like, oh, well, that makes sense. But it's like a naturally occurring sugar that's used in the body, but it tends to essentially make the bladder walls slippery so that bacteria can't hook in.
Oh, that's interesting because that's, like classically a doctor will say, if you're prone to UTIs, like drinking cranberry juice,
Mhm.
it's because it affects the lining of the urethra and bladder where they can't latch on. So it's a similar process. I'm sure I would rather take that than drink a gallon of cranberry
Yeah, yeah,
juice.
yeah. Well, yeah, you just take one pill. It's just, or whatever, one capsule of it.
Interesting.
And it's it's really, yeah, really powerful stuff apparently. I was taking D-mannose as well. Just like loading up on everything. I'm like, I don't ever want to deal with this again. Like
I
this has been
mean,
awful.
if you know that it's not going to give you horrible side effects, why not take it? What do you have to
Well,
lose?
it's like you catch a cold or something and you're like, it may linger, but like it'll work its way out of your system eventually. The thing about a bacterial infection is bacteria, if it's not dealt with properly, you can go septic. Like a
Absolutely.
bacteria infection can get out of control and cause major issues. And that's why it was for me, I'm like, well, crap, like this is not just like a cold that won't go away. This is something much more pervasive. And if I don't get to the core of it, I mean, my first thought actually when I was dealing with the bladder cramps was, is this interstitial cystitis? Because I was so unfamiliar with it. And you know what that is, right? My sister had that for 7 years. And I was like,
Painful.
oh God. And I looked up the symptoms and that was one of the symptoms. Now I muscle test, which is how I knew it was an infection, right out the gate when after I talked to Nisi and I was muscle testing, but I was just like, though thank God it's not interstitial cystitis because they don't understand that. Doctors really haven't come to terms with what it is, where it comes from, how to get rid of it. It's just chronic inflammation, right?
Mhm. But it's painful. I mean, it's very painful. So for anybody who hasn't experienced even a UTI, do you know what I mean? It's like obviously it's a form of a UTI essentially, but unless you've gone through it, the pain, and it's like it's all consuming too.
That's what she said. Like she couldn't focus on her life, and for 7 years.
All
And
consuming.
I knew another girl who had it, and both of them, when it went away, it's because they got pregnant. Both of them, they went away after they got pregnant and never came back.
Interesting.
Yeah. And I think that is the most bizarre thing. So I don't know if it's probably psychosomatic. It's probably like a mentally stressed induced obsession or thought process that's
Well, it's
cr-
hard like, when you're experiencing pain. It's like, and it's all you can think about. It
oh
does
yeah.
start to become all consuming, and it does inflate the issue. Not to say that you're not actually experiencing that pain, but when we're in our heads, it can make things much worse.
Oh, absolutely. And it is so hard to focus and like, you know, the morning I literally laid in pain for like 3 hours and I finally took, what is that called? Like aspirin. I was like, I just need something to kill this pain so I can function. Because it started at around 9 a.m. and then literally at noon it was kind of tapering off and I took the painkiller and I'm laying there and I fell asleep. I fell back asleep for like an hour and a half. And I'm nursing a geriatric cat and I wake up and I'm like, oh my gosh, is he okay? Like it's just, and I thought, like, I'm not a real parent. Like I don't have real kids. I just have pet, the fur babies. But like, oh my gosh, like this was all consuming. I could only imagine if I had a real job I had to show up at or had kids that had to be picked up from school or like I almost because my parents don't live in Vegas anymore. So I almost like called a girlfriend or my aunt to be like, can you take me to the ER? But I knew they were just going to be like, oh, we need to give you an antibiotic. And I thought, I'm not paying hundreds of dollars just to be told I need an antibiotic. So let me just get that called in instead. So
First line of defense.
like, and then I was just so curious. So I ended up doing because you can do, like there are websites where you can actually just order your own tests. And so just ordered my own urine analysis, I was just curious. So I was like, I don't want to go to a doctor and spend all this money. I'm just gonna figure this out for myself. And I did.
They actually have over the counter like strips. You can actually buy them on Amazon.
Hmm.
Will test your urine and tell you if you have a bacterial infection. So it's like for people out there who,
Tell you what kind?
I don't think they tell you what kind, but it will basically tell you if it's like if you have a UTI. And then
Yeah, I figured as much because I was like, well, I know I have something. I want to know what this is though.
so it's like I should look into it though and see if they have ones that will tell you what though. But usually that ends up you have to go give like a urine analysis to a doctor and then they'll tell you what bacteria it is.
I've done a lot of my own tests and I forget the website offhand, but because you can even just go into LabCorp or Quest or whatever and just order it yourself and then go in. It'll send you a thing, you take it in, and then they just do the test and then they email you the results.
That's perfect.
And I've learned over the years because I canceled my insurance in 2018. I was paying $400 a month for insurance just for myself. Like, I'm sorry, but when Obamacare took over, my insurance went to trash. And I had a grandfathered in plan from like when I was in college
Mhm.
with Anthem, but it became worthless. And I know there are good insurance plans out there. Like if you work for the culinary and here in Vegas, you can get that. Like some places do. But I would say the majority of us kind of like are shit out of luck with our insurance. And so I canceled my insurance because what happened was I injured my knee from yoga and I was like, this is bursitis. Like
Oh, yeah.
bursitis is another form of hell. It caused a subluxation and it caused the bursa to inflame. And like it would keep me up in the middle of the night. The pain was so bad. There was only one position I could sleep in. And I was like, okay, I need a cortisone injection. I'm not I'm not above that. Let's get a cortisone
Yeah.
injection. And so I called the insurance and I said, how much would it be to get a cortisone injection? And they said, we'll cover 70% once you meet your deductible. And I'm like, okay, well, I haven't touched my insurance in years. So what's it going to cost? Like I kept asking the same question and kept getting the same answer. I said, so I'm going to pay you 100% and the doctor 100%. And like, I said, so just cancel it. Just cancel it today. I'm done. And thank God I did. And so then I contacted my buddy, I don't know if my buddy, but a friend of mine. And because I have a lot of friends in the Indian community, very affluent. And so he's a spine surgeon. And I just said, hey, Jazz, if I come in, can I get a cortisone injection? He's like, absolutely. And I said, I have no insurance. I just canceled it. Because with insurance, it would have been like $800.
Oh my gosh.
And when I came in, he's like, I'm not going to charge you for the injection. I'll just charge you for the visit. So the visit was like 175. And then he don't even charge me for the injection. And thank God. But like when I got my last pap smear, because again, I just pay cash and it was 150 for the visit and $4 for the pap smear.
Really?
So I like don't use insurance anymore.
That's so interesting. I would have thought that they were, well, it's interesting that we're having this conversation now randomly because literally
Don't have
today,
insurance.
I was like, oh, I need insurance.
Mhm.
And because I was covered for X amount of time after my divorce, it was like part of our agreement. But like, that's up. And I'm like, oh, I need insurance. And I'm like, I don't know what to do. And like, here I am, I have an MD. And I'm like, I don't know anything about insurance. It's a different beast. And so I'm just like, what do people do? How do you find a plan? How much do things actually cost now? Like, I never thought
Pay
about it going
cash.
to a
Pay
doctor.
cash. When I got my breast done in 2014, the doctor was like, he's like, I require mammograms if you're over 30. But I did like insurance won't cover it unless you're over 35. And
Usually
so,
it's 40.
yeah, so I was like, okay. And then they were like, just ask for the cash price,
Usually about like $1,000, I think.
140. $140. Then they had the audacity, the insurance company had the audacity to charge me for it, $350. And I was like, no, 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 I'm under 35. You guys don't cover this. You're going to eat it. And they did. I was like, I paid cash for this. Mind your own business. This is not like you're like, yeah, they tried to actually like double charge me.
Whoa.
I hate insurance. And so, but yeah, it was $140 for the mammogram. And so I tell people who, especially in this climate, like if you're struggling, when I
Yeah.
got assaulted, my attorney was like, Paige, we have no medical. I had $500 or $600 in medical expenses. We're talking MRI, CAT scan, x-rays, doctor visits. They paid cash for everything. Literally didn't even come to $600 total for all of that. And I was paying $400 a month for insurance.
I mean,
So you don't need insurance as much as you think. And like for prescriptions, like GoodRx, when I picked up my Augmentin, $7.
I need to write that down.
So yeah, I mean, I gave up insurance like happily. And the only reason I kept it was like for catastrophe. And it's like, I don't know. I had an assault.
Yeah.
I had an assault without insurance and it still didn't. There are co-ops that you can join and you can do like a single person plan and then it'd be catastrophic. And I remember the last one I looked at was like $100 a month. And like worst case scenario, you get severe car accident, cancer, stuff like
Got
that.
it.
You're talking 10 grand out of pocket and that's it. And like 10 grand to me, like that's a boob job. Like, okay, fine. Like that's my catastrophic. Got it. Done. You know? But like so much, I just feel like so much of healthcare is just gone down the tubes because the insurance companies are clearly just trying to just consume all the funds. Like they've made it impossible for doctors to practice ethically.
That's why I didn't really go into practice, because I realized, oh, you just have to be a businessman or woman. You know, it's like, it's a business. It's not like, I mean, yes, you help people, but you know what I mean? It's like, if you want to be like really successful and make a lot of money, to pay back those loans, you really have to like basically be running a business and dealing with all the insurance companies. And I started to see that, bless you, in New York, a lot of places just straight up said, you pay out of pocket first and then submit to the insurance company. Because it's almost like they just like didn't even, and then like the insurance company just reimburses you for it. Like they're kind of like done dealing with insurance companies. It's weird.
Yeah, and there's a lot of doctors who are moving away from that. Thank goodness, because it's not worth it. But
Yeah.
like I said, I mean, it's a joke. Like I said, my MRI was $198. My CT scan was less than $100. Um, full body x-rays from head to toe was $140. I remember like just being shocked that like it was so cheap without insurance.
Yeah,
You
because
just take out the middleman and all of a sudden the facility can get paid.
and they probably actually prefer that.
Yeah, no, it's become such a scam. So, um, I'm definitely an advocate for like, don't fret. Like if you can't have insurance, you can't get insurance or
Yeah.
afford insurance, like trust me, like you're better off putting like $100 away a month or $200 away a month for your own issue. And then,
Rainy day fund.
yeah, like if something comes up, you know, I mean, it was a joke. My attorney's like, Paige, we can't really go for medical. There's nothing here.
There's a blessing and a curse.
I mean, like, you know, And I mean, I guess ongoing, because I did get a lot of chiropractic treatments, but even my chiropractor was only like $45 a session. Like it wasn't like, I've just learned how to get real treatment, you know?
I think that's helpful for a lot of people listening right now, and even myself included, because I literally was looking today at like, I don't know what to do about insurance because I've always had it through work or ex-husband, whatever. And it was just like, oh, how is this working at this point in time? And so I'm sure that that's really helpful for a lot of people to know.
No, absolutely. There's so much fear around insurance, like you're gonna just go totally like into debt if you don't have it, and it's not true. Now, if you let them try to convince you of everything going in,
Yeah.
perhaps, but like call ahead. I don't have insurance. What's your cash price? You know? Or like like I said in my case, I was like, they're totally, they're gonna tell me it's an infection, they're going to send me with an antibiotic, and I'm gonna spend $500 at a quick care. No. Or I don't even know if it would have been $500, because like it would have been 500 at an ER. At a quick care, it'd probably be like 120, 140.
Yeah.
But
Like
still,
the urine analysis, the visit fee, all that kind of BS.
but yeah, I like I said, I highly recommend like, and even if you have a, let's say you need insulin, let's say you need something all the time, you know, like those insulins are now capped, and I'm telling you, go to goodrx.com, look up the generic, look up your dosage, you'll be shocked. My dad he got a prescription for something. Maybe it was gabapentin or something along those lines. Went to pick up the prescription with his insurance. I mean, he's obviously over 65. It was going to be $800 for his prescription, and he was like, I don't think so, keep it. And he was so pissed off because it made him feel better. He wanted to keep taking, because the doctor gave him samples and he wanted to keep taking it. And so I just told my mom, I said, go to GoodRx, look up the generic form, look
Yeah.
up the same dosage, everything, $40.
How does GoodRx work? Do you actually talk to a doctor or do you just fill out something online?
You have to have the script, but then they provide the coupon.
Oh,
So you would go like you'd look online and you would say, okay, like I need it, like my prescription for, let's say, Augmentin, it's 10 days, this is the dosage, this is whatever. And then it'll give you choices. You can go through like Kroger, Walgreens, Walmart, and it'll tell you the discount and it gives you a coupon. And you
that's
just
amazing.
have it filled there.
Wow. Because I'd heard about it. I just never really thought about it or looked into it. That's interesting.
No, it's so resourceful. And that's why like, and it's interesting because like plastic surgeons, they're very different than like regular allopathic doctors, probably because their wheelhouse is vanity. And so they are much better about like, oh yeah, make sure you take bromelain before your surgery because it'll combat the inflammation, and make sure that you, like, they know those tricks. And so when I call him and I say, hey, this is my issue, he asks me, which one do you want? He was like, what antibiotic do you want? I remember I said, I'll take anything you think would work but Cipro. Like, like, just I've heard he's a little nasty. I said, just give me like whatever you think will do the job, but I don't want to have any Achilles issues, any tendon issues.
Yeah, yeah. And people have to be wary of, ciprofloxacin is a broad spectrum antibiotic, which means it's like they call it like the big gun. And it goes for everything. And you don't want to kill everything, unless you have a nasty bug that like that's the only thing that will work on it. But like you start with good old amoxicillin and then then work your way up.
Yeah, no, totally. So because he's not contracted. a lot of doctors are contracted and they're going to give you what they're contracted for. They won't give you necessarily what they think is best. And I learned that with my gynecologist years ago. I wanted a very specific prescription because I know my body. I know what types of antibiotics work with my system. And they kept saying Zithromax. My body doesn't work with Zithromax very well. And I said, why can't I get this one? And they said, because we're not contracted with them.
That's awful. So they're basically saying we care more about our profits versus your care.
Mhm. But not my plastic surgeon, he's like, whatever you need, whatever. Like he'll call in anything for me. Not to brag, but if I wanted Valium, he'd call it in. Like it doesn't matter. Like he's awesome. But I've gone to him on and off for different things over the years since I was like, I don't know, 28. So, I've referred patients to him. So he knows I'm not a druggie.
I was going to say you're not abusing the system,
Yeah.
which some people would. So that's good. At least you
Yeah.
have that in your back pocket. It's nice to know.
I might not have much going for me, but at least I'm not a meth head. Like there's that. Like
we may be having some really shitty days, but at least we're not meth heads.
Not to put down people who are drug dependent, but no, at least I have that going for me. Like, so.
We've got to look at the plus side.
But yeah, if anyone is struggling with the insurance thing, do not be afraid to like go without insurance. I promise you, there are ways around that. Like,
It's almost like the insurance companies fear monger and
they absolutely do.
put that idea in your head. And the irony is that it's so hard to even get insurance because the whole point of needing insurance is like illnesses, accidents, and yet you have to provide so much background of yourself to even see if you're accepted. So it's like,
And they're like, you had pimples when you were 15, and we have to deny you. Like,
oh, you are an Accutane?
exactly.
You don't qualify.
Like they don't want to take any risk. They just want to make money off of you. They're just like, we want to take your $400 a month premium. But we want to cover anything. Heaven forbid you actually need us. That we can't do. And yeah, Obamacare took over. I mean, Obamacare really is garbage. It's garbage. But but anyway, yeah. So back to bacterial infections.
Bring it home. Bring it home.
Now, you had done some research a little bit more specifically on that connection, again, between the brain and the gut, and you wanted to talk a little bit about that today. So,
well, we had spoken previously about that book, The Psychobiotic Gut. And so it's basically just like the brain gut axis and how important prebiotics, probiotics are to nurturing that environment in your intestines to like help the good guys out, give them their ammo that they need to fight for you, your immune system, and connected to your immune system. We talked about serotonin, where 90% of your serotonin in your body is actually made in your gut. Everybody thinks like, oh, I need to be on an antidepressant, like there's something wrong up here. And it's like, not up there, it's other places. And that's sending signals to your brain. And that's how that whole connection works. But having something like an overgrowth of the bad bacteria. And again, we all have E. coli in our system. It's just a certain kind of E. coli, the good guys. And just not being afraid of that and to just nurture that and to eat healthy foods and, to limit alcohol intake, all that kind of stuff, to really just nurture the system, because that's where your immunity is. It's in your gut, and how important it is to just take care of that and give the good guys a fighting chance. And and to not overuse things like antibiotics, because that's obviously that kills bacteria. things like that, to just be very aware of what works for your body as well. Like you said, you didn't have any of the classical symptoms of a UTI, but had you not listened to your body and known, like, this is not good, something's really happening. If you had let that go on, who knows, another week or so, I mean, you could have been septic,
Yeah.
septicemia, overgrowth of E. coli, like and once you get septicemia, then your chances of getting that again, and your immune system is shot. It really speaks to how vulnerable we are as well. And so to just really take care of your body.
Well, the thing is also, like, I see, different news broadcasts being made about insurance, about health, about all these things. And Bernie Sanders was talking about how, well, in Denmark, everything is covered at 100%. And I thought, well, in Denmark, our food's not being poisoned either, so that must be nice. You know what I mean? So like the reason to go to the doctor is not going to be as acute or pervasive or problematic because they're not in the same environment. They're not dealing with the same cultural, like norms and stuff that we are. I mean, Kellogg's is now being sued because parents are tired of like the colors, the food coloring in the foods for the kids. You know what I mean? So it's like your health is not just when you get sick and go to a doctor. Like your health is so many other different levels and layers. And this is why, like with the work that, I do and that you do, like with the team that I have now, it's about resetting the body physically to get inflammation down, to get cortisol to its normal space where it's supposed to be, where it rises in the morning and falls at night, and to help balance out all the different things in your body. And when you do that, all of a sudden you're like, hey, I don't need my blood pressure medication, or hey, my thyroid is functioning, or hey, like all of a sudden, like healthcare, it's a non-issue because you are your healthcare. You're taking care of those things. And 90% of the problems, you really shouldn't need a doctor unless it's an emergency. Like if you're really taking care of yourself, you shouldn't need a doctor unless you're like, I got a staph infection, like hiking
Yeah,
or something. Like you shouldn't need those things.
I totally agree. And it is our responsibility. Like it's not a doctor's. I mean, yes, it's their job to help you, but like you have to be proactive in educating yourself about your body. Like for females, it's, vaginal health. Like how does that work? Like what should I be doing? How does my diet affect that? Because you'll see that in different times of the month, you're more susceptible to a yeast infection. So it's like getting ahead of that and making sure you're taking a certain probiotic that cultures that and keeps everything in balance. So I'm a big believer in preventative treatment, which starts though with educating yourself on whatever topic it is, but to just get basic knowledge about the things that we eat and how they affect our body and why. Sometimes it's okay to say, well, why should I eat that? Well, let me tell you why you should eat that, because it helps with, this enzyme activation, which will then help this, which helps you make this. And when you get to see that and you understand it, it makes it more enjoyable to eat the food as well, instead of just saying, oh, I have to eat my broccoli. But let me tell you why broccoli is important, because it's a fiber-rich food. And what does fiber do? It helps regulate insulin. It helps bulk everything up to give you healthier bowel movements, which helps, you can see the cascade effect. And it's just time for people to take that responsibility and to just learn a little bit more.
Oh, absolutely. But it's like we wouldn't need to go to doctors to such a degree if we were actually just proactive.
100%.
I mean, Switzerland, if I'm not mistaken, has like a preventative system. Like they kind of incentivize preventative care.
It
And
takes hands, yeah.
I think that like, speaking of insurance reform, like if we had a preventative system, like even car insurance, like a lot of car insurance companies are like, yeah, like your premiums will go down if you hadn't had an accident. You know what I mean? And I think it should be kind of similar. Like if you're not using your insurance because you're healthy and you don't need it, then like, why are you being penalized? And it just goes up and up and up every year. Like that's ridiculous, you know? So it's not that
Absolutely.
we just even have like a health, we don't have a healthcare crisis. We just have like a cultural crisis in terms of what is appropriate and what is normal and what's not. Like it's just the fact that I'm the anomaly because I am eating clean, like that should just be normal eating. It shouldn't be clean eating. It should
That's
be
what
normal eating. Like, you know, and the fact that people think it's so weird that I would just want to eat meat for a month, you know, to like heal my immune system. I'm sorry, I don't know why that is so strange. Like, all, I mean, I'm literally detoxifying, I'm resetting, you know, the cell receptors so they can calm down, you know,
Mhm.
like I'm still congested from this cold that I caught from I'm like, I might just need to go carnivore again for 10 days just so that the congestion can just recover, you know?
And
And I don't know why that's so
Mhm.
strange to people.
And sometimes, yeah, no two people are the same. So it's like sometimes you got to try different diets, see what works for you, what doesn't work for you. But also, it's like, what do you have to lose?
No,
To try
totally.
to be healthy and try something new. It's people just want the easy way out.
No, they totally do. And it's like that expression, choose your hard.
Yep.
Would you rather work hard at making money or work hard at managing your debt? Would you rather like, you know, work hard at like getting up because you have allowed yourself to become something that can't function, you know, who doesn't have mobility, you're overweight, your blood pressure is not good? Or would you rather just, you know, get in your steps and maybe like stop eating after 6 p.m.? Like, you know,
It's
because you don't
hard.
have to go to extremes to be healthy.
Everything in life should be balanced, no extremes. And you're
No,
right. Choose your hard. Choose your hard. Do you want it to be difficult? Annoyed in the morning, having to get up because that's the only time that you can work out and getting to the gym and doing the workout? Or do you want to feel like crap? Like choose your hard because it's nothing in life is free.
well, even like with COVID, people who recovered faster obviously were healthier in general. You know, they were less subject to long-term issues because their body had the capacity to just move through it faster.
Because you've given your bodies the tools that it needed to fight an infection.
I mean, people don't realize this. By the time you're 30, your immune system doesn't modulate well at all. You're not 20 or even 25 anymore. By the time you're 30, your immune system is not modulating as well. And that's where you see the first signs of like my hangover lasted 2 days, took me longer to overcome the cold. Like that's where you start noticing that. And that is fixable. You can reset the immune system. Like there is no reason why people should have these degenerative issues that are just inflammation that has gotten out of control.
And but to also remember that small changes accumulate into big changes. And so every little bit counts. Like we said, we don't need extremes. It doesn't need to be all or nothing. It just needs to be, okay, what can I do today to make a little bit of a difference to work towards that long-term goal? And every little bit counts.
Yeah, because your body is always fighting to maintain balance.
Oh,
Always. It's working so hard on your behalf to maintain balance for you. And so like again, like there's really even people who are born with certain issues, and again, I don't want to knock the medical industry. The problem with the medical industry is that they're in bed with big pharma and they're more concerned with making money than they are about your health. And so if you want to avoid being a victim of that, then get your health on track. And not to say that you can't take advantage of certain. I was watching a podcast and he was saying, yeah, if you have mast cells, I'm sure you're probably familiar with that term.
mast, MAST, mast cells. Yeah.
And those are apparently really hard to regulate. Like if you're born with that kind of autoimmune issue, apparently that's really hard to regulate. Like most of us don't deal with that unless it's like we've just gotten way out of hand. Um, but like there are some people who they're just born with this signaling that they just keep. And he
Like
was
an
saying,
introduction, yeah.
I forgot what medication he said, but there was a couple different medications that actually kind of put them in check. And so like obviously medicine has its role,
Absolutely.
but we don't want to be like, oh, I don't,
It's
I'd rather, like have 10 beers and eat pizza every day of my life and then have to take all these medications because now I'm diabetic and I have blood pressure issues instead of just being like, maybe I'll just go do that on Fridays. You know what I mean? Like I eat whatever I want. I just don't eat whatever I want every day of my life.
exactly. You gotta homeostasis. You just gotta find your balance.
Yeah. So, and again, like people don't realize how that also affects your psychology. Like we are so totally everything that we eat. Oh my gosh. And just after being stressed for months and then to kind of watch myself, like I woke up one morning and I was like, that like it was right here. Just this like, how do I move through this piece of my life? All of a sudden I woke up and I was like, that's not there. I was like, but neither are my UTI symptoms. Hmm. Maybe that bacteria was the issue.
All connected.
And so it's amazing how when you make all of those changes, like you don't have the anxiety either. You don't have the depression either. You don't have even the ADD, ADHD, the like all of that stuff tends to wane as well. Like it's not so pervasive.
It's a good testament to, making small changes like tweaks to your diet, how it will have such beneficial long-term effects.
I mean, my whole thing is about just empowering people to be able to be as independent as possible in their lives from, the mental, emotional, physical. And so much of my work is mindset. It's like people are just distraught over like the way someone treated them and they don't know how to move past that, or they've just really outsourced their power. And it's like teaching people how to not outsource their power on the physical level is a little bit newer for me, even though I've practiced it my whole life.
Mhm.
But it's no different than anything else. Those controls are within yourself. You can absolutely be in a space where, okay, so I've taken this action and I didn't quite get the result I wanted, so let me try this now. But like again, just back to like even our first conversation about the gut microbiome, if I had known what I know now about the gut, like I wouldn't have willed it so much. I would have changed my gut. I would have been like, oh my gosh, like let me just make a few tweaks to my body. You know what I mean? So I wanted to override it with my mind as much.
Exactly. And you treat it well, and then you won't have to take all those pills. I mean, obviously some things you do need to take, but it's just good and that's why doctors always said first line of defense is diet and exercise. There's a reason for that. And then see where we're at with that, and then see if we need to supplement with something else. But you have the power. You can make a change.
Have you ever personally had an experience where you had an infection or you had something going on, and then as it treated, you actually noticed the difference even in your mindset?
Absolutely. I know it sounds silly, but like I suffered, from eczema, and eczema is, yeah, it's a certain disorder, but it's usually a manifestation though of what you're going through psychologically. So
Mm-hmm.
I've noticed that like when I was going through my divorce, I mean, I woke up with just huge patches around my neck. Even one morning I woke up and my eye was swollen shut. And it was just like astounding at how I knew when I would get really stressed and you kind of feel that heat come up your neck. And
Mm-hmm.
I started to learn that about myself of like, all right, next few days, here we go. It's gonna manifest itself. But then as soon as like that would calm and then I became calmer, you see the feedback loop. And it's stuff like that instead of just saying, oh my God, I can't believe I have eczema, it's like, oh, well, what are we stressed about? How can we get those cortisol levels in check? And how can we decrease the anxiety? And what are the things that I can do to have a little bit more control of the situation? But you see how that feedback loop, because if I looked at that patch and I got more stressed, it was just going to get bigger. And so when I would start to just get some like meditation exercises, learn to calm myself down more, you would see that the inflammation started to go down. And then I would feel better when that inflammation started to go away. And you're like, wow, it's really all connected.
Mm-hmm. Yeah, absolutely. Absolutely. Well, I definitely enjoyed this conversation as usual. I
I
think
know, I'd love to see where it takes us.
I told Katie, I said, I think next week we're going to discuss kind of the ungroundedness that everyone is feeling right now. Just
I'm
this sense
definitely
of,
feeling it.
just this kind of sense of, and I don't know that everyone is feeling it, but maybe it's like a post-COVID thing. I mean, I definitely, if I were to pinpoint when it started, it was COVID. Like I haven't felt, it's like something shifted in me and I can't undo it now.
That's how I feel. I really
Yeah.
do. I feel uplifted, and I'm like, okay, how do we start to come back down? How do we get more control? How do we work through this fog? Because that's what it feels like, a fog.
Yeah. And like I said, it's just, for me, it's been there since 2020, it's just been this like continuous ongoing space where I'm like, I guess this is what I get to navigate or manage now.
Let's just sit and manage it. How do we manage it? Stay tuned.
Yeah, exactly. Well, thanks for joining us. And Katie, thank you for participating and as usual. And so, yeah, whoever is enjoying our discussions, I hope to see you guys next week.